Scanning the room.
My name is Tiffany, and I'm going to be demonstrating wound care as well as obtaining a specimen culture for the wound. So I have my doctor's orders. I am in the supply room. My patient is Shirley Cost, 5/14/1964, and Dr. Leo has ordered a daily dressing of the wound with a wet to damp dressing, changing the dressing as needed, and I'm going to be obtaining a specimen for wound culture at 9 a.m. So I have performed hand hygiene. I have gathered all my supplies that I need, and I'm going to go into the patient's room. Good morning, Shirley. How are you? Shirley has confirmed her full name and date of birth, and I am going to compare that to her wristband as well as the doctor's orders. Shirley Coast, 5/14/1964. I have asked Shirley her pain level. She told me that her pain is a 4 out of 10, and optimally she would like to have that down to a 2. So at this point, I'm going to put her railing down. I'm going to don gloves. And then we are going to only expose the area needed. And we're going to roll Shirley over onto her side for the moment while we irrigate. Now at this point, if there was any kind of seepage on the bandage, I would take a marker and I would shadow. And then I would notate that in the chart. So I want to get out my biohazard bag. Have it ready. And I want to get my protector, and we're going to place this underneath. So that if we have any leakage or anything, that it will catch it. I am going to get my kidney basin, place that there. I am then going to get my syringe ready, as well as my sterile water and my angiocath needle. And we are now going to take off Shirley's bandage. So place that in the biohazard bag. So at this point, I would press around the edges of the wound to see if any pus comes out, making sure not to touch inside the wound or right at the edges. I am now going to change my gloves, and I am going to place the kidney basin right up underneath, and we're going to irrigate the wound. So I'm going to take my needle, my syringe, and I'm going to place the angiocatheter needle on it. I am going to draw out 30 mils of sterile water. And to irrigate, I'm going to go 2 inches above the wound, starting at the posterior, and I'm going to go back and forth. And I would continue and repeat this until the fluid coming out of the wound was clear. So at this point, I am going to don new gloves. I am going to measure her wound. Without touching the wound, we are going 7.5 to 5.5. So I would document this, as well as documenting as well as documenting the wound itself. I would do the color, the characteristics, and anything that I see. I am now going to take a culture specimen. I will take off the top. And when doing this, I want to make sure that I avoid touching the edges of the wound, as well as making sure I avoid the slough, the eschar, or any pooling exudant coming out of the wound. So this right here would be the perfect spot. I'm going to press firmly. I want to make sure not to roll it around. And now that I have my specimen, I'm going to place that inside without touching the edges. I am then going to get my patient's label, which says Shirley Cost 5/14/1964. Matches my doctor's orders. I'm going to place this on here, and I would write my initials, the date, and the time. I will place that in the biohazard bag, and I'm going to seal it and hand it to the CNA so that she can take it down to the lab. So I'm now going to place Shirley in the prone position so that we can repack her wound and dress it. Okay, so Shirley's in the prone position, turn her head. Okay, so I've performed hand hygiene, I've donned new gloves, and I am going to take my kit with my forceps, take out her bandage, and I have my gauze in here. I am going to add my sterile water, and then I am going to pull my gauze out. I'm going to wring it out because I don't want it soaking wet, I just want it damp. I am going to take my tweezers, and we are going to fluff it. And pack it into the wound. And then I'm going to take another one. And same thing, I'm going to wring this out so that it's not soaking wet, that it's damp. And I'm going to lay this right over the top. I am then going to get my tape. And I have my big gauze, and with the blue line up, I am going to place that right over the wound. And then we're going to tape this down. And with my marker, I'm going to write my initials, the date, and the time. I am then going to Shirley says that she would like to stay at the moment in the prone position, so we're going to let her do that. I'm going to perform my aftercare. taking off my gloves, performing hand hygiene. I have placed the call light next to Shirley. Told her I would come back in about an hour and check on her to see if she'd like to reposition. I have done my documentation of everything that I have performed, as well, like I said, as the size of the wound color, any changes to the wound, and I'm done.